What initially attracted me to this program was location, because I'm from here, but I did a sub-I or a sub-internship my 4th year and worked with Dr. Walker at Tulsa Center for Behavioral Health and really got to experience what it's like at this program and had a really good experience. The residents I worked with seemed very, very happy. Attendings all seemed very supportive. So I knew that this was going to be my first choice and where I wanted to go.
One of the things that I've always considered a strength of our program is that we rotate at so many different clinical locations. So we actually have residents providing clinical services at all 3 of the major hospital systems in the area. As far as our inpatient psychiatric services, we rotate at both a private hospital as well as one of the state hospitals, and so we see the whole breadth of services and patient populations that a city the size of Tulsa has to offer. We also rotate at a partial hospitalization program in the community for child and adolescent services, and we have numerous outpatient clinical sites that our residents are at.
Program is structured, it depends on what year you're in, right? So intern year, there's time doing family medicine, neurology, and then inpatient psychiatry. Your 2nd and 3rd year, you kind of alternate between the clinic environment and the hospital environment. And then your 4th year, there's a lot of elective time, and then you're also working with the new interns that are coming in and showing them the ropes and how to go about doing things and being a support for them. We have didactics on Wednesdays, and so that's protected time that we can learn and not have to worry about that being interrupted. I would say that the best part of our program is the people. That includes the attendings and the other residents. I feel like we all get along together really, really well. I can go to my attendings about things that, I may not be super comfortable with, and they're always supportive. Likewise with the residents, I feel like we mesh really well together, and it makes for an enjoyable experience for residency.
Being at the School of Community Medicine, we have a renewed commitment to serving the needs of our local community in Tulsa as well as northeastern Oklahoma. And right now we have a renewed commitment to recruiting and training physicians who are going to reflect the makeup of our community. We're also looking at contracts with local tribal nations to provide services for them, including in addiction psychiatry.
I really love living in Tulsa, mainly because there's a lot to do here. It's still small, but it's also big enough, lots of good food, and lots of things to do. I would say that this program has set me up for success in a way that I really didn't think would happen. So I never wanted to do academics or anything like that until I started this program, and it's just been such a positive experience for me. It's something that I'm really interested in, and I'd actually like to stay with the university. So they've kind of fostered me to, learn to teach and enjoy it and be good at it, which I never thought I was before. And so that's been really great, and I look forward to staying with the university when I'm done.
2 of the things that I'm most proud of in our program are that our residents, even being at a small Midwestern state, have access to world-class research as well as different programming, including assertive community treatment programs, as well as eating disorders programs, ECT services. These are all things that aren't always found at programs of our size in this part of the country. A second big thing is that our faculty are all here because they love to teach. So we're not here because we want to do research on our pet projects or just to bring in clinical revenue. Our faculty all want to teach residents and help them be the best physicians that they can be, both in the classroom setting and in our clinical settings.